Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring at a younger age. It is not uncommon now to see 25 to 35-year-old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Twinkle Singh Thakur is a well-known dermatologist and has been practicing medicine for over many years now. She is MBBS, FCPS, DBL and specializes in dermatology, cosmetology and trichology. Currently she is practicing as consultant dermatology at Skinfinity Derma Care, Shreeji Chamber, Raipur. Dr. Singh Thakur has dedicated her career to diagnosing and treating a wide range of skin and hair conditions by providing personalized hair care services to her patients. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Twinkle Thakur is also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Twinkle Thakur, for spending your valuable time to answer a few questions on hair care for us today. Welcome to this YouTube live show.
Thank you so much, Dr. Mona Sharmaji, for inviting me on such a beautiful, as it's a Doctor Day too, so inviting me for such a good topic for today.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया एंड टुडे लाइक वी आर गोइंग टू डिस्कस अबाउट हेयर केयर इन करंट सिनेरियो तो जब भी हम हेयर केयर के बारे में बात करते हैं तो इरेस्पेक्टिव ऑफ जेंडर एंड एज सबको हेयर लॉस की प्रॉब्लम होगी एंड देन दे कीप थिंकिंग वो ये नॉर्मल है कि नहीं है सो कैन यू प्लीज एनलाइटन अस टुडे विद योर profound experience what's normal and when to be concerned for.
फर्स्ट ऑफ ऑल एज यू वेरी वेल सेड कि हम सोचते रहते हैं कि ये नॉर्मल है कि नहीं. फर्स्ट ऑफ ऑल कोई भी हेयर लॉस नॉर्मल नहीं होता until and unless you don't get hair back on the same place. Hair loss is normal, but not getting growth in the hair, that is the issue. And second problem, as you very well said again, कि हम सोचते हैं. So second thing, the stress causes more hair loss. So हमें सोचना नहीं है, हमें action लेना है. And abhi I just say yes, middle-aged people, old-age people. Now you can't age specify this disease, this problem now hair fall because it's seen in almost all age group, whether it's middle, young, or old. It's seen in all age group.
ओके सो डॉक्टर लाइक कुछ ऐसे साइंस या सिम्टम्स होते हैं हेयर लॉस के कि ओके ना इट्स द टाइम कि हमें डॉक्टर को जाना चाहिए नॉर्मल नहीं है.
See, first of all, and again, I will say it is not gender specific, but yeah, sometimes there is two different types of hair pattern loss. One is which is male and female. First of all, when once if we talk about male, so male में हमें पता होता है कि हमारी hair loss हो रहे हैं. First of all, हमें genetics पता होती है हमारे ancestors, हमारे fathers and forefathers, हमको उनका पता होता है कि now they have hair loss और उनका कब start हुआ था. So firstly, we have that. Second is hormones, hormone imbalance, hormone change. Then again, frequent water and pollution base. So there is outside factor and as well as inside factor, which is a very severe cause of hair loss. Again, if we go to female pattern loss, again, for females, we can say the pattern, they have long hair, so it's very hard to maintain. Sometimes they don't know their right, correct, the product they are using. Again, same for them also, hormones, stress, eating habits, which are the major causes of hair loss nowadays. People are unaware about, and when if we talk about where to go, when to go to a doctor, again, when you see, then there's a we hypothetical for bookish language, we say 100 hair loss per day is normal. But then you don't know how much is 100. You can't keep counting, right? So whenever you see the frequency, up you can see hair. अगर आपको आपके टाल में दिख रहा हो, आपको आपके पिलो में दिख रहा हो, more hair brush में दिख रहा हो, so that's the time to go to your dermatologist for your hair care.
Okay, very interesting, doctor. So, doctor, you have said something about like general cause or like hormonal problems in females. So, like, can you please enlighten, like, क्योंकि जिनको हो रहा होता है उन्हें actually पता नहीं होता, and then they keep thinking मुझे ही क्यों हो रहा है, even though they take medications, they doesn't know like what is happening to them. So, what are those, like in more details, like what are those general causes for hair loss?
And general causes, first of all, one should start abusing their hair by, repeated coloring,
Mm-hmm.
non-chemical free colors, using iron and all straightening products, curling, ये हमें avoid करना चाहिए. Secondly, experimenting with new everything and anything, whatever you see on social media or whatever you hear to anything, and then you just start experimenting about it. And then, most important, stress. Stress is the
Yeah.
one of the most major cause of hair loss.
Mhm.
अगर आप hair loss हो रहा है और stress ले रहे हो, तो you are just encouraging your hair loss. Like hair loss will be more. आप
Mhm.
ऑलरेडी हेयर लॉस में हो और आप उसका स्ट्रेस ले रहे हो, दैट विल नॉट गिव यू एनीथिंग गुड बट दैट विल कॉज मोर हेयर लॉस. So yeah,
Yeah.
you should stop again. If we come to hormones, some
Mhm.
people have different types of diseases. Like we very commonly see hair loss in PCOS patient, and then facial hairs are there, and then we see in thyroid patient, then we have been see thinning of hair and falling of hair again in diabetes. So there are different disease based also. And
Mhm.
as we see when we have a chronic disease like typhoid or dengue, malaria, after that, hair loss is there. Because see, what hair does is hair is the second most rapidly dividing cells of our body. It
Mhm.
needs very nice nutrition. So yeah, whenever your body falls sick or wherever there is stress or wherever there is a hormonal imbalance, you will see the hair loss.
ओके, दैट्स वेरी इंटरेस्टिंग डॉक्टर, क्योंकि आजकल हम सब एक ऐसे लाइफस्टाइल से गुजर रहे हैं जहाँ पे वी आर नॉट स्लीपिंग वेल, वी आर वर्किंग
Yeah,
हार्ड एंड नो टाइम टू
not
लाइक,
eating properly,
सो
not
like
having
does
monitor of nutrition. Yeah, correct.
and more of the screen time, so can all these play a crucial role in hair health?
Yeah, yeah. See, as we have heard also, you must have also heard, everything in excess is not correct for our body. Again, if we go nowadays, more screen time, not having a proper sleep, not having a proper nutrition, not having enough balanced diet causes such problems. Then you will
Okay.
start noticing thinning of hair, breakages of hair, and then root falling of the hair. Seeing your the hairline is very easily visible. So all that thing.
या तो थोड़े थोड़े से शुरू होकर सीवियर हो जाता है, जो कि हम इग्नोर करते
Yes.
हैं.
Yes, कोई भी कुछ भी चीज ड्रास्टिकली नहीं होती, slowly slowly, but we what we do ना, initially we ignore such signs. We don't pay much attention. हमें लगता है ठीक हो जाएगा, मौसम है. We start looking for excuses. Maybe
या
I'm not having enough food, I'm not drinking enough water, I am taking stress. हम हर चीज slowly slowly it gradually increases. And जब वो
या
body crisis में आ जाती है, you see your hair fall.
या That's very interesting, doctor. So, doctor, now that we have talked about hair loss and the causes, so and due to this, era of lot of information, people get very confused, like कौन सा treatment मेरे लिए सही है and क्या क्या treatment होता है. कुछ लोगों को treatment पता ही नहीं होता, and they just buy it online and they just doesn't just know like is that right for me or not. So, what are those medical treatment options available for hair loss, like topical, surgical, or non-surgical? How should one, go for these treatment?
So, first of all, if you see your hair loss, one should
Mm-hmm.
not Google it first. Because
Mm-hmm.
see, सबके reasons अलग होते हैं, सब
Yeah.
hair fall का cause अलग होता है, as we already discussed, और
Mm-hmm.
हर किसी का pattern of loss भी अलग होता है. So
Mm-hmm.
first of all, we are not supposed to look for solutions in social medias, whether it's Google or it's XYZ platform. You should not look for such solutions. Other thing is when sometimes we already know the cause, like this is what I am doing, but I'm still keep on doing it. कि eventually वो ठीक हो जाएगा. Like not
Mm-hmm.
eating properly, taking stress. So you need to have your balance diet, as I already said. Third, you should rush to your doctor to know the cause. Basically, we are unaware about it and we will just keep on experimenting with different products. So you should go to your doctor as soon as possible and just look for the cause, whether thinning is the cause, because hair fall starts with thinning and breakages.
Mm-hmm.
Whether the cause is your like internal or external, whether it's hormonal or it's your body in the crisis, not a proper nutrition, or it's outside environmental factor. Again, dust, pollution, having lots of product, using wrong product. We should not experiment with our hair, because when it's damaged, and it's damaged होने में बहुत कम वक्त लगता है, and repair takes longer time.
Mm-hmm.
So you should go to a doctor, and there are various treatment options available nowadays, like starting from local solutions which you have to apply like daily basis. Now, now we have solutions which you have to apply like you have to apply lifelong till the time you want your hair. It just goes under maintenance. And few now we have serums like we containing Redensil, Procapil, that you can use for a particular period of time. As soon as your hair is like normal in a growth, you can stop it. But few products you can't stop it. You have to continue it. So do not start or stop any product without consulting your doctor. Now we
Okay.
also have like solution. Now we also have products in a oral tablets form. That is multivitamin. That is again starts with multivitamin and then oral treatment form. So there are these. Then you have various options like you can go for PRP. You can go for different hair therapy. Now PRP is again is platelet-rich plasma. We did it do it just with a growth factor with your own blood components. That helps to enhance the growth of the hair. Then you can anytime go with PRP. Then you can go under good nutrition again. Then you can also go with the hair transplant. For me, hair transplant is the last option. Before that, you have many more options. Like you have 2 to 3 steps of options. You should not directly consult for hair transplant. There is a step, you can go step by step. What if we can get better hair in 1 or 2 steps just with the solution or with the multivitamin, just completing the need of the body and your nutrition requirement, even that helps.
ओके ओके सो जो लोग पूरी तरीके से बाल लूज कर जाते हैं क्या उनके लिए भी कोई ट्रीटमेंट अवेलेबल है?
हाँ, वो ऐसे लोग जो पूरे now again it is a universal alopecia or it is a global, we also call it global. उनके लिए भी एक part of मतलब you have still have chances like you can again go अगर कोई chances है scarring हो गई है non scarring है scarring है we can still think about it अगर hair follicles live है which you can do otherwise you can anytime go in the hair transplant which is very much safe.
Oh, very interesting, doctor. So, doctor, like we've been talking about nutrition. So, though people know that okay, nutrition, matlab acha khana, but they doesn't know
Yes.
like what is micro or what is macronutrient, and also they get confused ki what is what. So, can you please enlighten like what are these role of micronutrients in health, hair health, and how the plate should look like for a day-to-day life person?
See, if I will say that your food or your habit, you should have a daily routine में you should take vitamin D, B, and then zinc. So हमें ऐसे समझ में नहीं आएगा. See, and every body is somewhere or other deficient or some or the other nutrition, which we can see. And again, the multivitamin play a very major role in maintaining a healthy hair. So, as main essential things what we have for our hair is you should have proper iron rich food जो भी food आप जिसमें iron हो food or fruits वो आप लें जिसमें again which is very helpful for hair growth again zinc which is very important then vitamin D वो तो हमें टेस्ट करके भी पता चल जाता है अब ऐसा कोई टेस्ट नहीं you don't know the content of the body you can go
Yeah.
through blood test and then whatever the deficiency is go with iron zinc vitamin D B so you can have idea of what is deficient and then you can add in your diet and plus, now you have tablet, you have such supplements also, which are containing such things like amino acids. And if you are anemic, then check with your HB level, then you can go accordingly, have zinc. So like that you can go.
Okay, that's very interesting, doctor. Thank you so much. This discussion was very informative, doctor. So, can we take some live audience question?
Yeah.
हाय डॉक्टर, मैं भी रायपुर से हूँ। मेरी बेटी 12 साल की है और उसको बहुत सारे सफ़ेद बाल हैं और मैंने सारे घर के नुस्खे अप्लाई कर लिए पर बाल काले नहीं हो रहे हैं। इस एज में काले बाल क्यों नहीं आ रहे हैं? क्या कर सकते हैं? और कैन आई टेक एन अपॉइंटमेंट?
Yes, you can anytime take an appointment, ma'am. And hello, first of all, आपने क्वेश्चन पूछा इस एज में काले बाल क्यों नहीं आ रहे हैं तो हम क्वेश्चन ही गलत पूछ रहे हैं हमें ये क्वेश्चन करना चाहिए इस उम्र में सफेद बाल क्यों आ रहे हैं सो लेट्स स्टार्ट विद द राइट क्वेश्चनिंग सो आपको ये सोचना है कि इस एज में क्यों आ रहे हैं तो हमें फैक्टर्स सबसे पहले बच्ची आपकी 12 साल की है तो ऑब्वियसली सच क्वेश्चन इज वेरी हाँ ऐसे क्वेश्चन आपके दिमाग में आएंगे क्या आपकी बेटी का न्यूट्रिशन सही है is she taking a proper balanced diet is she taking home based food is she having a proper sleep proper stress life अब हमें graying of hair what you're talking about is premature panitis we call it अब ये क्यों होता है again nutrition is the cause
Mhm.
Some chances are hereditary genetics, but then majorly at this age group, we it directly indicates this indicates that nutrition is not proper. Maybe और अब आप हो सकता है कि आपको लगे कि आप सब न्यूट्रिशन दे रहे हैं, स्टिल उतना नहीं है. मैंने तो बहुत बैलेंस डाइट रखी है अपनी डॉटर के लिए. अगेन शी इज 12, whatever you
Mhm.
feed she will eat. So ऐसे में क्या होता है ना, sometimes our body is not absorbing that much. It still
Mhm.
needs more. It
Yeah.
means the body wants it more. The body is showing the sign by graying of hair.
Mhm.
This is one of the signs. And anytime
Okay.
you can visit.
Okay. And this can be reversed or controlled?
Yeah, this can be, surely this can be. And because this is sign, उसके बाद eventually आपको thinning दिखेगी hair में, hair fall दिखेगा. So it's
Mhm.
better. You can visit anytime you want. We'll guide you. We'll do our best.
Okay. Very interesting, doctor. So another question from our viewer is, hi, doctor. I am 35 years old and I'm diabetic. Recently, doctors added insulin in my regimen, and after that, I have been having a lot of hair fall. Is it because of insulin? Should I stop it?
No, hello, ma'am. But you shouldn't stop insulin, which is more required more than your hair because it's your diabetic profile again. Again, insulin के कारण hair loss? No, not.
Mm-hmm.
I don't support such things because
Mm-hmm.
नहीं हो सकता. Very less chances. Again, हो सकता है कि आपका diabetic profile आप बहुत सारे already परहेज कर रहे होंगे. Already you must be having a diet control. So
Mm-hmm.
insulin is not causing it. You should not stop insulin. Never a patient like a diabetic should stop it or any medication. You can anytime add supplements.
Okay.
So yes,
Okay.
hair fall हो रहा है आपने क्योंकि control diet किया होगा because of the diabetic diet chart. But then you can anytime ask your doctor and just add multivitamins and diabetic pills.
Okay, very interesting, doctor. I'll just quickly take one last question because we are running out of time. Uh, Hi, doctor. I'm 44 years old and I have androgenic alopecia. And someone told me that hair transplant ही ultimate solution है. हालांकि मैं minoxidil ले रहा हूँ. आप क्या suggest करेंगे? क्या मैं hair transplant करा लूँ?
सर यहाँ पे मुझे देखना होगा अगर एंड्रोजेनिक एलोपेशिया आपके किसी डर्मेट ने कहा है तो श्योरली यू मस्ट बी सफरिंग फ्रॉम दैट. बट अगर आप मिनॉक्सिडिल डाल रहे हैं और अगर आपके डर्मेट ने मिनॉक्सिडिल आपको सजेस्ट किया है, देयर स्टिल चांसेस. बट या ग्रोथ मैंने जैसे बोला, क्राइसिस होने में, हेयर फॉल होने में बहुत जैसे टाइम लगता है वैसे हेयर रीग्रो होने में भी टाइम लगता है. सो व्हाट यू हैव टू डू, you can again visit, you can still look for treatment option. Minoxidil is anytime ultimate good, very good option. It has very nice, hair growth की possibilities. Again, you can add multivitamins with your minoxidil. And then last option is that ऐसा नहीं है. You can still go with PRP. You can go with microneedling derma roller. You can still go. There are many more, possibilities. So you can just consult your doctor for that possibilities. You can go for PRP. You can go for rollers. जो हमारे निडलिंग होती है, you can still go for that. And then if you don't get results, again this takes time, but if you don't get results in like for 9 to 12 months, then you can anytime hair transplant is the option. But before that, you should look for your chances.
Yeah. So you can always consult with the doctor and then
Yeah, you
keep.
can anytime consult your doctor. Yeah, you can still look for your chances. Now, what you can do.
Yes, doctor. So, doctor, finally, can you please, would you like to give any take-home message or any other suggestion to our viewers today?
Yes. So first of all, for hair, I just want you all to know, stop experimenting with random products. Whatever you see, you just don't buy it and use it because whatever the contents are, we are still not having a complete disclosure about it. So do not try random product. Do not experiment your, hair with random coloring or random, serums. If you see online that this is a hair growth, no, until unless you don't know about the product, not what they describe. You or your dermat don't know about it, don't use it. Number one. Number two, if there is a hair loss, don't, aggravate it by taking stress. Rush to
Mhm.
your dermatologist, you can still take care of it.
Mhm.
So taking stress is never the solution. It is just adding more, putting one more point and just putting add on your hair. Number three, do not, overheat, over iron your hair.
Mhm.
Take proper nutrition, take proper balanced diet, eat home food, eat nice food, good food, whatever you eat. See, it's a very simple thing. Whatever you eat, it seems on your hair and your skin. As
Yeah.
simple as that.
वेरी इंटरेस्टिंग डॉक्टर. सो मेरे बाल गिर रहे हैं ये सोचने के मुझे डॉक्टर के जाना चाहिए.
मेरे बाल गिर रहे हैं, 2 गिर रहे होंगे और सोचने पे 4 गिरेंगे. सो डोंट गो टू अ
Yeah.
डॉक्टर.
Thank you so much, Doctor, for sharing all your expertise with us today and answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful. And thank you so much, Doctor. It was a delight to have you, and I really enjoyed talking to you. And thank you so much for your valuable time.
Thank you so much, Dr. Meena. Hope you all
And
enjoy.
also,
Thank you so much.
yeah, thank you so much, also viewers, for joining us today. If our doctor has some time in future, we can bust some more facts about more into hair care and skincare, and let's do that if she has time. Until then, doctor, please take care of
We
yourself.
always have time. We always, Dr. Mona, we always have time for a patient. You can anytime freely call for consultation. You can visit us. You can anytime take an appointment and come to us. We are here to help you, and we would love to help you.
And also, like, you guys can Google doctor's name with her clinic name is Skin Infinity Dermatology, Shreeji Chamber, Raipur, and you can always take her appointment by calling her. Thank you so much, doctor. Let's sign off for today and do take care of
Yeah.
yourself. Bye bye.
Thank you so much. Thank you so much. Bye.